Hi, I'm Odessa Lewis for the Power of the Patient Project, and joining me today is Christina Schmidt. She's a small town Minnesota native and has been surrounded by and involved in the healthcare system for years. She is currently a part time student at Gustavus Adolphus College and is serving on deployment with the Army National Guard as a healthcare specialist at Camp Bureid, Kuwait. In the future, it is her goal to become a provider after completing her degree in biology. As a senior researcher, Christina made a major contribution to the MedFocus Research study this past summer. Welcome, Christina Schmidt. First, tell us about your role of a senior researcher for MedFocus Research. What were some of your responsibilities in this role?
Yes, of course. So, as a senior researcher for MedFocus, I worked as part of a team to identify the perceptions of a sample of patients of their experiences with healthcare providers and how it's affected by the social determinants of health. So, we, along with Mr. Kaiserman, who was a wonderful advisor, by the way, created a research plan which involves preliminary research, sample and study design, survey administration, and creating a final report at the end. So we created 3 different patient surveys on primary care, women's health, and mental health, and held another special survey from the provider's perspective. So I personally worked close with preliminary research and the initial literature review. So with this, we had a good idea of what pieces of the social determinants of health were needing further research. Then I helped the team design the study and the sample by creating potential survey questions and peer reviewing my team members' work. And then after the surveys were created and implemented, I helped to analyze and interpret the data and finalize the report.
Okay, okay, nice. So can you share some of the findings of the study with us?
Yeah. So I worked closely with analyzing results of the provider survey specifically, so I'll kind of talk about those. So these surveys were aimed towards the healthcare providers to get a gauge on their needs, perspectives, and the obstacles within their practice. So we learned from the results in our survey that providers can most effectively provide high quality care um, when they have like 5 different criteria. So this includes adequate time spent with the patients, patient compliance to the medical recommendations and treatment plans that they're giving them, and the presence of mutual respect. So just like working together as a team with patients and providers, effective communication, which is always a must, and little interception from outside sources on the medical care. So I'll talk about those 5 later, but generally the results that we saw in these 5 categories indicated that the providers believe that they're creating a space that is conducive to these criteria. So 74% of providers are reporting that they feel they have enough time with patients. 81 are stating that they believe that they're able to accommodate patients of different ages, genders, nationalities, etc. And then we have 92% of providers that are reporting that they feel that they honor their patients' cultural backgrounds and values when providing care. And then another 81 state that they remain neutral about personal views when treating patients. So those are all really like high statistics, like in the 70s and 80s. So again, like our results regarding providers' perceptions on effective communication are supporting this. But to highlight some of the problem areas that we found in the study, I'll highlight that 40% of providers responded affirmatively when asked. Okay, so there was 40% of providers that responded affirmatively when asked whether they felt there was mutual respect between providers and patients.
Mhm.
So that means that we had 60% of providers feeling like they didn't have mutual respect. So that's a clear indicator that honesty, openness, respect between the provider and the patients, as far as the recommendations and the treatment plans, are
Mhm.
really key to building a healthy patient-provider relationship. And then another area that I want to highlight is that last criteria that we talked about is the interference from outside sources. we had 74% of providers reporting that they believe insurance companies are sabotaging the needs of patients.
Oh, wow.
So that's a bold statistic, and it shows a clear obstacle that both providers and patients are going to have to work together to overcome and change for the future.
Right. Okay.
Yeah.
Wow. Um, so can you tell us about your work over in Kuwait as part of the Army National Guard? Explain how your work supports the medical team at Camp Buring and how your work on the study this summer influenced your personal work.
Yeah. Yeah. So my work here at Camp Buring has changed many times, as the Army usually does. So I worked for about 3 months in a COVID-19 isolation and quarantine facility. So when I worked there as a junior medical specialist, it was my responsibility to communicate with the patients, in process and out process the people who were coming through, because Camp Buring kind of works as a pit stop. You know, people
Okay.
fly into Kuwait, stay in Camp Buring for a little bit, and they might fly somewhere else.
Mm-hmm.
So we were in processing and out processing people all the time. And then we had to provide direct care and observation to those who actually had COVID-19.
Mm-hmm.
So there was a lot of work that went into that. I've also participated in a lot of training exercises that taught basic first aid and tactical combat casualty care to both American soldiers as well as our Egyptian counterparts when I participated in a Bright Star mission. So since my time here, my company has also provided medical care to Afghan refugees
Okay.
after the crisis there. So I personally was a part of a Role 2 mobile aid station.
Mm-hmm.
So we have basic um, medics working the floor, x-ray, we have lab and just basic imaging and a couple of doctors.
Mm-hmm.
So we were treating men, women, and children who had essentially left their lives behind
Mm-hmm.
to the dangers that were plaguing Afghanistan at the time. And working as a provider of medical care, I think the biggest lesson that I've learned from participating in this project is to always take the social determinants of health into consideration from the second that patients enter our facilities. So that was really vital to our mission at the time, because we were seeing patients that we weren't used to
Mm-hmm.
treating. Like, I, as a soldier, am a medic to treat other soldiers.
Right.
I'm not treating children, I'm not treating the elderly.
Mm-hmm.
So it was really important to our success to ensure that like patients were given the proper resources to receive the highest quality care that we had available here.
Mm-hmm.
So, you know, through that understanding of each other, it fosters a system where um, there's well-being for both the patients and the providers.
Mm-hmm.
Yeah.
Okay.
Mhm.
Okay. So finally, based on what was learned from the study, what are some things that providers can do differently to create a better experience for patients when they visit a healthcare office?
Yes. So if you take a general overview of the results that we gathered in the study, you can see that patients are mostly satisfied with their experience of visiting providers' offices. But the lessons that we want providers to take away from this study is that personal attention and communication is really what's vital to creating a positive experience for patients. So patients expect empathy from their providers,
Mm-hmm.
and they expect respect and care from the healthcare workers and the administrators that you're seeing in the office, not just the providers.
Mm-hmm.
That all comes together and is going to create a nurturing environment for them when they come into the office. So we're encouraging providers to listen to patients, not just about their medical concerns, but to take a deeper look into all of the other social determinants of health, all of the other aspects that affect their medical care and affect the way that they are going to interact in the office.
Mm-hmm.
So there's always going to be room for improvement in these aspects of, you know, interpersonal care. as time continues, the medical field is always changing and reshaping and
Mhm.
reforming. So that's why organizations like the Power of the Patient Project exist, so
Mm.
that we strive to really just maintain and create improving experience for patients and providers alike.
Okay. All right. Well, that's the end of our interview. Thank you so much for allowing me to interview you today.
Of course, yeah.
Yeah, I hope you enjoy the rest of your day.
Yes, thank
And
you so much for talking with me. I look forward to doing other interviews and cooperating with MedFocus more. So thank you.
all right, you have a good one. I'm
Yes,
Odessa
you too.
Lewis for the Power of the Patient Project. Thank you so much.